So estrogen is a protective of our joints and muscles. And when estrogen leaves the party, when 35, 40, 45, 50 happens, and as your estrogen continues to go down, your joints and your muscles, they kind of become a little bit different. They become stiff, brittle, kind of like a stiff brick, because your estrogen helps with the elasticity, think stretchiness, the ability to be buoyant, full of hydration and plump. You know that your skin is becoming more dry, your ears are becoming more itchy, your hair is more dry. So envision your joints and your muscles and tendons and ligaments having some of the same problems. One piece of that puzzle is we lose the elasticity because, well, estrogen is protective, but estrogen also is a motivator of us to help us move our bodies. So then you're not only losing your hormones, which are helping you stay moist, plump, and all the good things, and lubricated in all the ways, but you're also losing a drive to move. And because you're not moving as much, those bones, those joints, those muscles, they're not getting the care that they need. So your joints become stiffer, your muscles become not so pliable, and then the inactivity sets in, and then everything becomes like a shrinky dink. And if you're so lucky or not lucky, frozen shoulder can happen, plantar fasciitis. And these things happen due to hormonal shifts, inactivity, and oftentimes there are other underlying orthopedic problems. And this is why I, as a physical therapist, talk a lot about hormones and perimenopause and menopause and what this does to your body. Because if you knew that estrogen was really important for your flexibility and your elasticity, and it even affects how you make muscle, you would perhaps maybe start doing more mobility routines, more stretching, more lifting, because 8% of our muscle bulk goes away each decade after 40. I am generally saying we lose 1% of muscle mass each year, just to help you understand it is coming year by year. And so with your neck, your upper back, we're losing muscle bulk. We are losing bone density. We don't have the elasticity. So with our head and neck, we have to work on our thoracic mobility because our posture becomes more slumped. When you turn your head left and right, 50% of the rotation is at C1 and C2, but the rest of it goes all the way down to T3 and T4. So your thoracic spine is exceptionally important for your neck. Not to mention your pecs become tight, your upper back becomes weak, your arms become what I jokingly call ham hocks. Your neck muscles become disproportionate. For instance, you get this forward head posture and your neck kind of does this weird thing, and then the back gets really tight. Then you start to get headaches, and then you can get suboccipital headaches with this like referral pain because everything locks down. But what you do matters. You can change by doing mobility routines. Yoga, I always recommend to my patients, if you don't know where to start, look up sun salutations because movement is medicine. If you aren't tracking your steps yet, walking increases blood flow, helps your mobility overall, helps your brain, helps your mood. And then I talk about weightlifting 3 times a week for at least 20 minutes so we can turn on human growth hormone to make muscle bulk. Does that technically fix neck pain? No. But what I'm saying is you're witnessing in a small, isolated part of your body what a decrease in hormones does to the rest of your body. And your body's saying, help me. And then I'm like, okay, we're gonna do mobility, we're gonna walk, we're gonna lift, we're gonna sleep, we're gonna nourish our bodies, we're gonna do the things because our bodies are changing. And it doesn't mean like we're so broken we can't come back, but you are now a high maintenance being. Now that we're perimenopause, menopause, our bodies are like little divas and they require a little more finessing.